What you need to know for your medical school exams, MI management. The management of myocardial infarction, also known as a heart attack, is a critical aspect of care for medical students to understand. There are several key steps involved in the management of a heart attack. Step number 1. The recognition of symptoms. The first step in managing a heart attack is to identify its symptoms, which can include chest pain or pressure, shortness of breath, sweating, nausea, and lightheadedness. Step number 2 is the activation of emergency services. If someone is experiencing symptoms of a heart attack, it is important to call emergency services immediately. Number 3 is the administration of aspirin. Aspirin is often given to patients experiencing a heart attack as it helps prevent further blood clots from forming. Step number 4 is transporting the patient to the hospital. The patient should be transported to the hospital as soon as possible, where they will receive further evaluation and treatment. Number 5 is rapid assessment and treatment. Upon arrival at the hospital, the patient will undergo rapid assessments, including electrocardiogram or an ECG and blood tests, to determine the extent of the heart attack and to identify any underlying conditions that may have contributed to it. Step 6 is reperfusion therapy. Reperfusion therapy is a critical component of management for a heart attack, and it involves restoring blood flow to the heart muscle as quickly as possible. This can be achieved through fibrinolytic therapy or percutaneous coronary intervention, or a PCI. Step number 7 is risk factor modification. After a heart attack, it is important to identify and modify any risk factors that may have contributed to its development, such as high blood pressure, smoking, high cholesterol, or diabetes. Step number 8 is long-term management. Patients who have experienced a heart attack will require long-term management, including lifestyle changes, medications, and follow-up visits with their healthcare provider. In conclusion, the management of a heart attack is a complex and multifaceted process that requires prompt and effective responses. If there are any other medical school topics you want me to explain, leave them in the comments.